Your body is designed to repair itself. The question is, are we supporting that repair or just covering the cracks? You ever notice something about the ocean? It looks peaceful, but it's relentless. The tide comes in, the tide goes out, salt water, wind, pressure, day after day after day. And even something as strong as this concrete pier slowly starts to break down, not because it's weak, but because it's constantly under stress. Here's the part most people don't realize. Concrete piers don't usually fail from the outside first. They fail from the inside. Salt water seeps in, it corrodes the steel reinforcement inside the concrete, the steel expands, and eventually cracks start to form. Sound familiar? That's exactly what happens inside your joints. Your knee doesn't just suddenly fall apart. Your shoulder doesn't randomly go bad. It's years of micro stress, inflammation, small injuries, wear and tear, and chemical irritation, slowly changing the internal environment of the joint. From the outside, you look fine, but inside, things are breaking down. Now, here's where medicine traditionally steps in. We wait until the cracks show. Then we patch the surface. Steroid injections, that's like painting over the cracks in the concrete. It may look better for a while, it may feel better for a few months, but you haven't addressed what's happening inside. And surgery, well, that's like tearing out a whole section of this pier and rebuilding it. Sometimes necessary, but it's not maintenance. It's major reconstruction. What regenerative medicine tries to do is something different. Instead of covering cracks, we try to change the environment inside the structure. PRP, platelet-rich plasma, uses your own growth factors to signal healing. Stem cell-based treatments and biologics aim to support tissue repair and modulate inflammation. Shockwave and laser stimulate cellular metabolism and blood flow. We're not just numbing symptoms, we're trying to improve the internal biology of the joint before it reaches structural failure. And here's something important. Even this pier gets inspected, maintained, repaired, because nothing exposed to the ocean lasts forever without upkeep. And the same is true for your body. Regenerative medicine is not magic. It's not immortality. It's not one shot and you're done for life. It's strategic maintenance. Just like replacing corroded reinforcement or sealing concrete to prevent further salt damage, your tissues live in a world of stress, gravity, and time. But if we improve the internal environment, we can slow progression, reduce pain, improve function, and potentially delay or sometimes even avoid major reconstruction. The ocean isn't the enemy. Stress isn't the enemy. Use without recovery is the problem. Your body is designed to repair itself. The question is, are we supporting that repair or just covering the cracks? If you're dealing with joint pain, back pain, tendon problems, or early arthritis, before you assume surgery is your only option, let's have a conversation about regenerative strategies. We do this every day at Elite Spine and Joint. We evaluate the structure, we evaluate the biology, and we design a plan that supports repair, not just temporary relief. The tide's always coming in and going out. The goal isn't to stop it. The goal is to build a structure that can handle it. If you want to learn more about how regenerative medicine may fit into your situation, reach out to us at Elite Spine and Joint. Let's talk about maintaining your pier before the cracks widen.